Okay, thank you, and hi everyone. I'm sorry I couldn't be there in person to be there for Lei's talk. So I want to introduce Lei Li, who's been with us at the unit at the MRC Epidemiology Group for about a year now, and she's visiting us from Huazhong University of Science and Technology. And we spent the past year looking at the effect of short-term air pollution variations on stroke admissions. Unfortunately, Lei's time is coming to an end, so she is leaving next week. So I guess all good things come to an end. So that's quite unfortunate, but it's a really good opportunity today to hear what she's been up to. So without further ado, Lei, the floor is yours.
Thank you, Hani. Hi, everyone. I'm Lei Li, and I'm a PhD student at Huazhong University of Science and Technology. And I'm currently visiting the group Public Health Modeling, and I'm working with Hani, as she has said. I'm very happy to share you about our work on independent and joint effects on multiple pollutants and their interactions with meteorological variables on stroke hospitalizations. Here is a brief overview of my presentation today. Firstly, I want to give you an introduction about our work. According to Global Burden Disease Study 2019, stroke is the second leading cause of death and the third leading cause of death and disability combined. Our previous study have proposed the link with the link of stroke with air pollution and weather variables, but there is still limited knowledge about potential interaction effects between meteorological variables and air pollution on stroke hospitalizations. And most of the previous studies mainly focused on independent effects of specific pollutant. So we want to figure it out what's the difference and the connections between joint effects of multiple pollutants and with the independent effects of pollutants on stroke. And also we want to know whether the short-term effects of air pollution differ by stroke subtypes, because stroke is a very complicated, complex disease, and it has several subtypes here. So the stroke data were collected from 62 major hospitals in Shenzhen from 2006 to 2014. The information includes sex, age, educational level, date of hospitalization, stroke diagnosis, and ICD codes. This picture illustrates our stroke data. During the study period, we collect more than 100,000 stroke data, and it could be divided into three main subtypes: ischemic stroke, hemorrhagic stroke, and stroke not specified as hemorrhagic or infarction. You can see the last one only accounted for less than 0.2%. So our analysis mainly focused on the first two subtypes. This is the picture of a variation of daily stroke hospitalizations during the study period. We can see a slow upward trend on all strokes and ischemic stroke and hemorrhagic stroke. Air pollution data were obtained from 9 fixed site air monitoring stations, evenly located across different administrative districts in Shenzhen. We collected 5 criteria air pollution during the study period, and daily mean concentrations of pollutant were calculated by averaging the available monitoring data. Meteorological data were provided by Shenzhen Meteorological Service Center. It includes ambient temperature, relative humidity, and air pressure. This is the variation on daily air pollution concentration and meteorological variables. We can see a slightly slow downward trend on air pollution, except for ozone. It's small, but we can see. And clear seasonality on meteorological variables during the study period. Here I attached the daily air pollution concentrations in Shenzhen, and I compared it to that in London. So we can have an idea about the daily air pollution concentrations here. Although Shenzhen is not an industrial city, but the concentrations of air pollution in Shenzhen is much higher than that in London, except for ozone. And our work used a time-stratified case crossover design. The case days were defined as the date of stroke hospitalization, and control days were selected as other days in the identical day of the week, month, and year as a case day. For example, if we select today, Wednesday of September 2023 as a case day, then control days are other Wednesdays of September 2026. 2026, sorry. And we use conditional quasi-Poisson regression to conduct the model. Firstly, we built initial model, and we introduced water regressive terms into the model to address the possible water correlation in time series data. And also, we adjusted for day of the week, public holidays, and time stratified. Based on that, we applied natural spine functions for temperature and relative humidity to control for the confounding of meteorological variables. We use quasi-cake information criteria to choose the degree of freedom for temperature and relative humidity. After that, we built single pollutant model and access both current day and cumulative effects of each pollutant. As for cumulative effect, since our previous lag effect showed that the effect of air pollution on stroke could last for up to 4 days. So we select 5-day moving averages of pollutants to capture the cumulative effects. Also, we conduct subgroup analysis based on season, sex, age, and educational level. And we also built a multi-pollutants model to establish the model to estimate the joint effect of all possible combinations of two pollutants and specific mixtures. About the specific mixtures, we can see, I will introduce you in later, yeah. Apart from that, we've also built interactive model to investigate interactions between meteorological variables and air pollution on both additive and multiplicative scale. The additive interactions was assessed by the relative excess risk due to interaction, and multiplicative interactions were assessed by adding the interactive term into the model, and we can obtain the p-value for the interactive term. A p-value less than 0.05 indicates existence of multiplicative interactions. This is our main results. These plots show the association between all strokes and multiple pollutants. We can see that NO2 can increase the risk of all strokes, and the joint we observed a significant joint effects of NO2 and PM10 combined on all strokes, with similar in magnitude with the individual effect of NO2 alone. And the specific mixtures I mentioned before, there is a destination here. About the subgroup analysis, we can see the effect of NO2 is higher in the cold season than that in the warm season, and also the effect of NO2 is higher among males than females. Just to see the comparison between the red line and blue line. And this is the association between pollution and ischemic stroke. NO2 increases the risk of ischemic stroke, and we can also observe the significant joint effects of NO2 and PM10 combined, with similar in magnitude with an individual effect of NO2 alone. And also we found a slightly smaller joint effect of NO2 and ozone combined. And the subgroup analysis in ischemic stroke is similar with the effect, the results on all strokes. The effects of NO2 are higher in the cold season and among males than that in the warm season and among females. Yeah, we didn't observe significant link between hemorrhagic stroke and multipollutants, but in the interactive analysis, we found temperature and PM10 as well as ozone has an interaction on hemorrhagic stroke. From the additive interaction, which you can see this line, temperature can amplify the effect of ozone on hemorrhagic stroke by 0.03%. And from the multiplicative scale, we could find significant interactions between PM10 and ozone with temperature on hemorrhagic stroke. But unfortunately, we cannot know how big is the multiplicative interaction is. But we know that there is an interaction, multiplicative interaction between them. About the interactions between relative humidity and air pollution, we didn't observe any significant result. So in conclusion, our main finding have proved that NO2 increase the risk of all strokes and ischemic stroke hospitalizations. It is also supported by previous studies, and it is biologically plausible. NO2 could lead to activate astrocytes and disrupt synaptic function and induce endothelial and inflammatory responses. Thus, it can lead to stroke onset and progression. Also, we found joint effects exhibit a similar magnitude to the individual effect of NO2, which is also supported by previous study suggesting the predominant role of NO2 in pollution mixture. Here I attached several studies. One study reported that no significant associations between stroke and any of the other pollutants after adjusting for NO2. And another study also reported only NO2 remained significant associated with stroke after adjusting for co-pollutants. And we also found interactions exist of temperature with PM10 and ozone on hemorrhagic stroke hospitalizations. The underlying mechanism is unclear, but we still got some several hypotheses about this. Temperature change could increase the sweating and minute ventilation and cardiac output, and consequently increase uptake and distribution of pollution in human body. On the other hand, temperature change can change people's activity pattern and exposure to air pollution. We have to admit that our work has several limitations. Firstly, we use the city level exposure because the air pollution were collected from the averaging value from 9 fixed sites in Shenzhen. So there is some bias between the estimation using population exposure to the individual level exposure estimation. And due to the limitation of data, we couldn't estimate the effect of PM 2.5 on stroke. But of course, PM 2.5 has a very important role on health outcomes. And also we didn't address the collinearity among multi-pollutants model because of the limitation of existing methods. But I have to point it out that during our study period, except for the correlation between NO2, SO2, and PM10, the other correlation coefficients are less than an absolute value of 0.6. And also our work has a 9-year span and a relative high daily event counts. So there is a potential for mitigated impact on of collinearity on model performance compared to other studies which have shorter time span and lower daily counts. But this also guide our future research plans. In the future, we may investigate more meteorological methods to address the collinearity among multiple pollutants models. And also, as I have mentioned before, we didn't quantify the multiplicative interactions in this study. So in the future, we can trying to quantify the multiplicative interactions not only between meteorological variables and pollutants, but also between multiple pollutants on health outcomes. Finally, I want to thank Dr. Ping Ying's team at Huazhong University of Science and Technology, and also the Public Health Modeling Group at Cambridge. Yeah. Thank you for your support and help during my visiting year. It means a lot to me. And also I want to thank all the staff who contribute to the data collection and dataset management in Shenzhen. Here I attach several references of our work. And thank you for your time. And here we come to Q&A part. Please feel free to ask questions.